John Carney, thank you for joining us once again after 2-week hiatus. We're back with our weekly press conference on Delaware's response to COVID-19. I'm joined here once again by the leaders of our team, Dr. Carol Rattay, the Director of the Division of Public Health. It's great to see her again. She and I had a couple town hall meetings the last 2 weeks instead of the weekly press conference. And of course, we have AJ Shaw, our director of the Delaware Emergency Management Agency, who not only is doing his work with COVID-19, but had a nor'easter snowstorm that had to deal with over the last couple of years. Last couple of days didn't affect us too badly, AJ, I don't think, but put a little bit of snow on the ground for the first time in a long time, and of course impacted states to the north of us much more than it did to us. We have Pam as well, our sign language expert. We appreciate her participation as well. In the interim, we've had the swearing in, my swearing in as governor. Thank you for the opportunity to serve another 4 years as your governor. We also had the swearing in and the inauguration of our new president, our own native son, Joe Biden. And we've been working with his COVID-19 team, even with the press or with a conference call earlier today with the National Governors Association. Already we're getting some good news about that. I'll talk about that in a minute, but I want to thank again AJ and Dr. Rattay and their teams for really their tremendous work. I keep saying, you know, we've gone through kind of the hardest part. The hardest part is getting to pushing down that initial surge back in the spring. The hardest part is getting folks to wear masks and keep social distancing. The hardest part is bringing sectors of the economy back online and back into business. Then the hardest part is getting children back in school, and that has proven to be a challenge, getting folks to respond to the surge that we had there during the Thanksgiving, December holidays and New Year. We feel like we got some really good news to talk about today with respect to the number of positive cases, which are declining, the number of hospitalizations, which are declining, the number or the percent positive of the tests that we are doing, which are declining as we continue to test at a higher rate, or I guess I should say sustaining that very high rate that we established a couple months ago. So lots of really good news. We're getting now vaccine out the door and into people's arms. We've significantly vaccinated those frontline healthcare workers, nurses, physicians, physician assistants, all the folks that work in the hospitals, first responders, paramedics, police and fire, up and down our state. All those we've got another program that's been working on the nursing homes and the workers in those. We've made progress. We still have a lot of work to do. We're now getting second doses into that first group. About 30,000 of the initial 50,000 doses that we received from the federal government went to those 1A for healthcare workers and first responders. And so they're back now for their second doses. We'll talk a little bit about that. We've been meeting our targets. We're one of the better. So we've had some bumps in the road. And for those of you who attended or tried to attend the large vaccine events that we had at the DMV in Georgetown and in Delaware City and had to wait an inordinate amount of time, I want to apologize to you for that inconvenience. Those of you who were able to stick it out and get through and get vaccinated, we're glad that you were able to stick it out and do that. And to all the volunteers and all the folks who made that event happen, we appreciate it. We made some miscalculations, had some challenges with weather and freezing equipment and that type of thing, but we learned a lot. That was Saturday. We did several thousand people that day. The next day, Sunday, was much smoother as we addressed some of the challenges that we faced the day before and learned more about the needs of vaccinating, particularly a much older population, which that was over that weekend, and getting our many of our 1A first responders vaccinated as part of those large events as well. So let's take a step back again and take a look at where we are. Again, some good news there. We're going to have just a brief summary of the data So those new cases, 466 now. We were over 800 just a few weeks ago. So that's trending down. That's the 7-day moving average. We're under 500. We're still at a high level. We don't want to say that, everything's great. If you remember back in the summer, I was complaining about new positive cases that were on average, around 100 per day. So we're 4 times that, but we're getting better on a day-to-day basis. Our target for the percent positive, the number of tests that we're doing that are positive, is 5%. To be under 5%, you can see 7-day movement average here under 7%. So we're getting close to that. We were up around just a few weeks ago, up around 10%. And so again, gradually getting better and healthier. And hospitalizations, of course, that really important measure that we really follow. That number now at 326, as of yesterday, was up over 470 just a couple weeks ago. So trending in the right directions. The number of lives lost, of course, sadly, continues to increase at 1,108, each one a precious life, someone's parent, relative, neighbor, and really what we focus on, that and hospitalizations, to try to get people to follow masking guidance, social distancing, and now making sure folks get vaccinated. And that's a really important point. The vaccination is really effective, both Pfizer and the Moderna. Dr. Rattay might want to expand on this, in preventing hospitalization and fatalities. And that's really what we've been focusing on to try to keep those numbers down. So let's look at our vaccination numbers. And again, both the numbers that I just gave you as well as these vaccination numbers are on our de.gov/coronavirus website. For vaccination, you just go and click on the vaccine tracker, which is at the top. You'll see these numbers there. You'll see the number that were delivered, over 120,000 now delivered from the federal government. We were getting them at a rate of between 15 and 20,000 a week. We didn't get much notice, which made it very difficult to plan for the events to get those doses into people's arms. As I said, the vast majority of the ones that we got early on went directly to the hospitals for their staff and partners in the community. And then we increasingly got more as we did more of those 1A first responders, frontline healthcare workers, and the like. And now moving into 1B, our senior citizens, 65 years and older, with a focus on the older members of that cohort and those that have pre-existing conditions. So of those 120,000, we've actually administered 107, almost 108,000 of those doses, some of which are second doses, so they don't represent all of them a unique Delawarean individual. We're always going to have a certain amount on hand, or that are with our partners, the hospitals, the pharmacies, and the physicians, because they need to be resupplied every week so that they can get those vaccines into people's arms in that next week. So there's always going to be a little bit of a flex there. We try to keep it at the rate with which our partners can deliver the vaccine, so we don't get a backup. We actually could handle a lot more vaccines if the federal government was making them available. We did get word on the White House call earlier today, led by Jeff Zients, President Biden's lead for COVID-19 response, that we're getting a ramp up 22% more supply, and guaranteed to a certain extent over the next 3 weeks, so we can plan on that. And I know for AJ and Dr. Hong and their teams, that's a critically important improvement. More vaccines, but more importantly, knowing how many we're going to get so we can allocate them to our various partners for the following week. So those are the numbers at a very high level. Testing numbers continue to be incredible. As I mentioned, our goal initially was 80,000 a month. We hit 200,000, I think, AJ, at our top. And now I think I heard you say we're at 190,000 or thereabouts, which has kept going after the holidays. I frankly expected it might slack off a little bit, but the interest is still there, and that's a very, very good thing. That only represents not our total population, almost 600,000. We have just short of 1 million here in our state, so obviously people getting tested more than once. So on the next slide, you can see again the distribution of those positive cases. The two lines at the top are those two young adult crowds, the 18 to 34-year-olds and 35 to 49-year-olds that are unfortunately leading the way. And a lot of that is, social gatherings and not being as careful as in mixing households and with friends and family members and travel and all that kind of thing. Just need to be extra careful there. Of course, the most vulnerable group is our senior citizens over 65, and that's where we're targeting our vaccination efforts at the moment, as long as with second doses for the 1A workers. The next slide again shows from the beginning the two peaks back in the spring. This is hospitalizations. Again, that number that's very discrete. We know it. We get the reports from the hospitals. It's not something we have to test. And so it's a very clearly, easily known number. And you can see the run up in late April, early May, then the decline as we moved into June. The really good months from July through October, the end of October, as we saw Halloween, and then into Thanksgiving. And you can see the run up in hospitalizations in late December and January. We went from 107 on November the 7th to 474 the second week in January, which was the peak. And now we're down the other side, hopefully, fingers crossed, at 326. That's still comparable to the peak back in the spring of 337 on April the 17th. So that was our peak in the spring. Our peak here so far in January at 474. Now we're down to 326. So we're heading in the right direction. We still need folks to wear the mask, keep social distance, make sure you follow the rules for indoor dining and gatherings. We're in the winter season where people are indoor more than they're not. We've got lots of sports activities going on that require mask wearing. Just follow those guidance and we'll continue to get healthier. We'll be able to bring sectors of our economy back online, and we'll prevent hospitalizations and deaths in our population. So here's just a map of the United States, which shows you the effectiveness of various states in getting the vaccinations received from the federal government into people's arms. We're actually among the top 10 in the country for that, as we really made a sprint to get vaccines from the shelves and the freezers with all of our partners, hospitals, doing their own folks, helping us with communities outside of the hospital, helping with their partners, healthcare workers, physicians, others in the community, with our pharmacies, and we're ramping up pharmacies a little bit. So make sure you pay attention and get to your pharmacy if you're 65 and older to see if you can get an appointment there for a vaccine with primary care physicians as well. So that's our foundation of our delivery system. And then of course we have large vaccine events. We're now going to be targeting communities in our state where we have more vulnerable populations, minority populations, low-income populations that we're not seeing at some of the large clinics that we're getting. We've targeted some of those already and learning more effective ways, partnering with faith communities, with community organizations to get to those populations and make sure they're getting vaccinated as well. But overall, we're getting vaccines into people's arm and protecting all of us in doing so, and that's really important. We had a very successful event, large vaccination event this weekend at the Chase Center. I was there for several hours talking to folks as they got their vaccine, went into the room where you have to wait for 15 minutes to see if you have a negative reaction. Just talking, met some of our senior citizens. One woman was 102 years old, just as spry as could be, walked in, walked out, and met another gentleman that's going to turn 100 years old on January 17th. It was just so heartwarming to see so many adult children bringing their parents, elderly parents in to get life-saving and life-preserving vaccination. So it was an event that went very well. People had to wait, it sounded like about a half hour, all told 15 minutes of which was in the cool down room where folks waited to see whether there was any kind of reaction. And we didn't have the challenges that we did with the weather and the cold in the 2 prior weeks. So you live and learn. We're getting better at it. Our partners are getting stronger. We're getting more vaccines to get to our partners. So make sure you're paying attention and contacting your local pharmacy and your primary care physician, and hopefully we'll have supply. If we could get supply from the federal government, we could do a lot more vaccinations. We could have larger clinics, get more to the pharmacies, more to the primary care physicians, more to our hospital partners to do outreach into our communities as we're going to do. I mentioned that community outreach. We need to have an equitable distribution of this public good, life-saving vaccine. So we're partnering with community organizations, much like we did, frankly, with testing. And our testing rates in those communities rose significantly as we did that partnering and had testing sites in school parking lots, in church parking lots, at local libraries within the community. It's a little bit different because you need that 15-minute period where you're following your symptoms, making sure you don't have a reaction. There are other preparations that have to be made on your sign-in and registration. We have to have some mechanism for getting you registered so you're in the system, and so we don't have a chaos as people flooded various large clinics as we've seen. So we will have digital toolkits both in English and Spanish, and we'll be delivering education materials door to door, and again partnering with our community partners to get that word out. The last thing on my list is to encourage people to sign up for our online app, our COVID Alert DE. We're almost 100,000 downloads. This is an effort to protect yourself and people you may have come in contact with. If you test positive for COVID-19, you will anonymously register that you've tested positive, and you can get notices out to people who are also registered anonymously that they may have come in contact, or they did come in contact with you within 6 feet for a 15-minute period of time. Very helpful tool. It's anonymous. You don't have to worry about folks knowing where you are, that type of thing. And it does help you keep track of where you've been if you end up testing positive. And we're right there at the 100,000 download mark. So we need, looks like 3,000 more downloads to get over that milestone. So with that, again, I want to thank Dr. Rattay, tremendous work of her team. Probably the most important work that we're doing, I keep saying that, getting children back in school, vaccinating our population, particularly those most vulnerable, those on the front lines, healthcare providers, first responders, just doing a great job with it. Very difficult, challenging. We've had some bumps in the road, but we feel like we've learned a lot, and we're on a better course now. Got to get out into all various communities in our state, particularly those that are harder to reach, make sure everybody's getting vaccinated. Dr. Rattay.
Thanks so much, Governor. And yeah, we would agree with you completely. Lots of challenges this year, but this mission to get Delawareans vaccinated and to protect them as quickly as possible is an incredibly complex and important mission, even more challenging given the scarcity of vaccine. But we are excited about the progress that we have been making. We're also excited about some of our numbers that we're seeing as far as cases and percent positive and hospitalizations improving in our state. As I often show the areas of concern slide, viewers have probably saw or recall in November, December, earlier this month, when we had very high cases. Much of the state was lit up. When we looked at the zip codes that had over 500 cases per 100,000 people, much of the state was impacted. So it is heartening to see that the numbers of zip codes that meet this criteria have decreased significantly. Most of those areas that we're seeing now are in Sussex County, Georgetown, Laurel, Ocean View, Del Mar, Dagsboro, and Selbyville. The only Newcastle County zip code that meets the higher criteria is Townsend. Nonetheless, still as a state, we still have, higher rates than we've had at certain times of the year, like in comparison to the summer. So it is really important, especially now that we have some of the variants circulating, or specifically the UK variant that we're aware of, that we double down on mask wearing and social distancing and not gathering. So let me shift gears a little bit to take a look at our vaccine tracker. As the governor said, we are really excited that we're now at 107,000 vaccines that have been administered in the state. So in a state under 1 million, that it's really gratifying to see that we have about 10% of our population that's received at least one dose already, which does provide protection to a number of individuals across our state. And as the governor said, we are really excited that we're in the top 10 of states. I think it really shows that we know how to quickly get vaccine into the arms of Delawareans. Additionally, we've been able to show through our larger events in the last 3 weekends that we were able to administer about 25,000 vaccines, almost 2,000 at the Chase Center at our first real indoor event this weekend. So, we are learning a lot, but I think have made a lot of progress in knowing and understanding, even in cold weather, how to administer larger amounts of vaccine. That being said, we know that these larger events aren't the only way that we're going to get our entire population vaccinated over the coming months. And so our very important partners, medical providers, as well as pharmacies, have always been a critical part of our vaccine infrastructure. And although they've received very little doses to date, as we move forward, as the federal allocation of vaccines changes, you'll see those a lot more opportunities with medical providers and pharmacies open up moving forward. So I want to talk a little bit, though, about who is getting vaccinated and who is signing up. And we are very concerned that we are not reaching all Delawareans in an equitable way at this point. I will point out that we do have some concerns about our data. Now, a new national study showed about 50% of vaccines in the nation don't have race or ethnicity data. We are doing better than the nation with 30%. Still, this number is unacceptable to us. It's new data for a lot of our providers to put into vaccine forms. Nonetheless, we want to drive that number down quickly, and this is really important to our governor, who will have more to say about this in the as the week goes on. But what we see now from our data is that only about 5% of Black Delawareans have been vaccinated, and only about 2% of Hispanic Delawareans have been vaccinated to date. And so these numbers are not okay with us, and it's really, really driving us to make some significant changes in how we are reaching underserved populations.
Yeah,
I also...
if I could just jump in there for 1 minute real quickly. One is we know there's the possibility, and we've heard from our partners in conversations that we've had, some vaccine hesitancy among these communities for historical reasons. So we know we need to get over that. One of the main ways that we make appointments for our large vaccination sites is through the registry. And so we would encourage everyone to work with their elderly church parishioners and others to get registered. You can also do it through the call center. That's really important. That would be the easiest and best way to do it. We know that's time consuming and difficult. And so we're also going to do a lot of community outreach to take those vaccinations, much like we did again with testing. And I think we'll learn more effective ways to do it. We'll know what our partners, as Dr. Rattay, can deliver in terms of pharmacies and primary care, and our hospital partners who have also been helpful with us, were helpful with us in the spring as we ramped up testing in these vulnerable communities. So we'll continue to work on that. We got to get our data straight first, and we've emphasized that. If you don't know where you are, you don't know where you got to be. And so we know that we're not where we want to be at this juncture.
Yeah, thanks, Governor. I mean, we know as far as our registry goes, we don't have equal proportion of minority population signed up for the registry. So for example, only 7.4% of individuals signed up in our registry who are 65 and up are African-American Delawareans, and only 1.6% are Latino. So we really would like to see more folks get on the registry, but it also really is an important signal to us that we've got to find other ways to reach people in their communities. And so we have a number of things underway. I want to give a huge shout out to Lisa Henry on our team, who is so committed to our community work. And Lisa and her team from Community Health Services is gearing up to start doing some vaccination in partnership with the Wilmington Housing Authority this week with several high rises, but we're working with folks across the state in some of these low-income senior residential settings, housing settings, so that we can expand and really get to these sites in the coming weeks. We also we have a number of pharmacies now that have been receiving vaccine from us, but we have really, we're really focusing in on those pharmacies that are in Delaware zip codes that have more vulnerable populations, more lower income individuals. And so we're really targeting those pharmacy efforts. We're asking the pharmacists to reach out to their regular clients in those areas. Additionally, medical practices in underserved areas are also getting an increased allocation of vaccine this week. And that also includes, I really want to give a shout out to our federally qualified health centers, who are real trusted entities in our communities. And so we're really grateful to the work that they are doing, but other medical practices are really standing up. I want to give a huge shout out to ENT and Allergy of Delaware, Dr. Joan Coker and Neil Hochstein, who are so committed, they and their teams and their families, in really volunteering and really getting out there. So they've already started connecting with some churches to start vaccinating some of our seniors in faith-based settings, which is great. Additionally, as the governor said, our hospitals are also working on outreach efforts. So just this past weekend, BB partnered with First State Community Action and La Esperanza and La Rosa to vaccinate about 300 individuals in Georgetown. And this upcoming weekend, Christiana Cares planning an event in Wilmington to reach vulnerable members of the community who are being provided appointments. So, you know, it's a multi-partner effort to reach underserved communities, for which many Delawareans are committed, and we are grateful. So moving on, as we get more vaccine in Delaware, you'll see expanding options for all. Second doses is a topic that we've been addressing quite a bit over the last few weeks, especially for those in the 1A population, or those individuals who came to our larger events who are 65 and up. A lot more details to come for those who are 65 and up and who came to those events. So be patient with us. You'll be hearing more about how to access your vaccine. But for those in 1A, many in the health system have already received their second doses. We began EMS events this week, so a lot of first responders have received or will be soon receiving their second dose, as well school nurses and others. So hold tight, second doses are on the way for those who received their first dose. We also are working on the waiting list, which has over 100,000 seniors on it now, in a variety of ways. So AJ will talk more about the great work he and his team are doing with Vault and Curative, but we are using those resources to help get those on the waiting list vaccinated. So for example, Curative is vaccinating about 200 people from the waiting list this week. And next week, Curative in Dover and Vault in Wilmington will also be providing vaccines to people on the waiting list. And as we mentioned, we were able to get more doses to medical providers this week, as well as pharmacies, and we see that expanding as we go forward. The bottom line is really, we are building a capacity, and we already have the capacity to receive and administer much more vaccine than we have in the state. But we are excited that we do have this network, this system, where we can get a lot of vaccine to people. And so as soon as the federal government gets us more vaccine, we are ready, whether it's Moderna or Pfizer, but we're also really excited about the Johnson & Johnson vaccine that we hope is just around the corner. Also very effective vaccine, very few side effects, extremely well tolerated, and very importantly, it's only one dose, which is really easy.
Yeah, really good point there at the end. You see these options here, second doses for 1A and everybody else, frankly, waiting lists with Vault and Curative, tremendous capacity with Vault and Curative, with our medical providers, with our pharmacies. They all could take a lot more. It's really a function of how much we're getting or not getting from the federal government. If we got 4 times what we're currently getting, so instead of getting 20 to 25,000 a week, we got 100,000 a week. We could distribute it in a week through these partners and through larger events. And so that's really what it's going to depend on. The Johnson & Johnson 1 dose is a game changer. When that comes, it's just simply a game changer because it'll give us another source of supply, depending on how many they can ramp up and how quickly, for those subsequent groups that we're looking at to get their first dose. And this is only 1 dose. The whole second dose logistics is challenging. And if you think about it, as you do more and more first dose folks, when they come back around for their second dose, if your supply is not increasing, those second doses are going to crowd out doing more first doses. That's just the simple math of it. And so we need to expand supply. We need to get to Johnson & Johnson with 1 dose in order to use our networks here to get everybody that needs to be vaccinated. And that's another point. We have a lot of people, notwithstanding the tremendous demand among our 65 and older population, who are saying they don't want to get vaccinated. First responders, people work in hospitals, all that. And that's not really a good thing. We want to get everybody vaccinated. It does free up a vaccine for somebody else, but that's not what we want. We want everybody to get vaccinated and to get protected, particularly our first responders, frontline workers, and our vulnerable senior citizens. AJ, tell us about testing. And what else, whatever else you have.
You think almost 12 months of pandemic, I'd be faster with the mute button, but thank you, sir. Before we get into testing and talking about Vault and Curative for vaccination, really going to talk about some federal funding news. And actually, this isn't even updated with the announcement we got just in the last few hours. But as with any crisis or disaster, and if you think about the disasters we get federal funding from, it would be the tropical storm from Isaias last year, or winter storms, or flooding events. However, last year, COVID was considered a federal disaster declaration, opening up FEMA funding to support state and local government and some eligible nonprofit organizations with reimbursement. At the time, it's 75%. It looks like that's going to be going up to 100%, which is great news. But so far, the team that's really worked on recovery And this is we've used complicated a lot, I think, during this pandemic, but when you work through the public assistance program to get the FEMA funding, so there's a lot of regulations and worksheets and meetings that go through to make sure you scope it out. You're following procurement guidelines at the state level and the federal level, et cetera, to get the money back. But to date, already recovered almost $28.8 million for the state, including local governments and schools as well. This has been for testing. This has been for PPE. This has been for sanitizing equipment for first responders or schools or nonprofits. This has been for some feeding programs for those that have been most hurt by this pandemic. So this number is going to continue to grow. This recovery effort will be with us for probably the next 3 to 5 years. So it's not something that's going away. And again, we have a dedicated team that works with our partners up at FEMA to keep us, getting as much as we can to lessen the burden on our local governments.
And that's an important point, AJ, lessen the burden on our local governments, because otherwise, without this assistance, that would be money that we would have to set aside for our state budget, county budget, and local government. So it's really helping make sure that we can deliver necessary services and education, healthcare, all the rest of the things that we do, as well as our first response and our COVID-19 response, our public safety personnel. Having these resources from the federal government will enable us to have a better budget situation here in the state. Just had our budget presentation to the General Assembly last week. It's much better than we expected it to be. This will make it better still.
No, so good going from that number to little smaller numbers, but still something to be proud of is our testing numbers so far in 2021. The 16th through 22nd of January, we were at 55,000. Last week, we took a little dip to, just under 50,000. We know this week's going to be much lower than that. We had to cancel several testing events yesterday because of the weather, a few today as well. So I would anticipate next week when we're going over these numbers, it will be south. But as the governor alluded to when we opened up, the demand is there. I think we were both talking about it before this. We expected to see it kind of decrease in that 2 weeks post New Year's. It's still up. And remember, this is the at-home process. This is the curative or drive-throughs, the trailers that we were on the state, and a lot of other doctor's offices or the antigen testing that's out there during walk-in clinics or been given to some of the schools. So ample testing options out there. Go to de.gov/get-tested to find out what's in your neighborhood and helps you out. But that's how we're going to help everybody, this on top of the vaccine. Newcastle County, we have 11 events scheduled throughout the remainder of the week. We know there's a few big ones on there with the University of Delaware on Friday. We have Delaware Park that will be Friday as well as the Woodlawn Library with the trailers. So some areas that we know we brought in great numbers before on this. Again, if we miss Monday and Tuesday, we're going to try and get back to those communities early next week as well, so we don't leave anybody untested. Kent County, we have 3 events remaining in this week. Today was the Clayton Fire Company, tomorrow is Harrington Fire Company, and then Hartley Fire Department on Saturday. Down in Sussex, a few more options. We'll be doing some school testing down there as well, but about 10 options as well between today and this weekend. So all this information is at de.gov/get-tested. Remember, if you sign up for these in advance, you're in and out. As soon as you get through the line, check in, swab yourself, and drop it off in the collection container. So very easily, and I'm happy to report turnaround times are down well under 48 hours now. So if you remember, right around Thanksgiving, Christmas, we're getting back up to that 3 and 4 time range for a lot of these events. It's now down to a much manageable level. Governor?
If I may, Jay, this is another good indicator that people are dialed in. They're paying attention. They're going out and getting tested at these incredible rates, which means they're thinking about, whether they've been exposed or not. They're thinking about maybe there's something coming up where they've got to be cautious about family members. That's a really, really good thing. And in addition to the mask wearing compliance that I see really across the board, you add this on top of that. And I just feel really good that people are dialed in, they're paying attention, they understand what it takes. And these testing numbers, I think, bear that out. AJ, thank you for you and your team for continuing to keep those numbers up where they need to be.
Thank you, sir. And it's a balancing, because we need to keep the compliance up, we need to get the testing up, and keep moving with the vaccination. So lastly, Dr. Tate talked about bringing a few partners on to assist the state. We've talked about these partners now for months in the testing realm, Curative and Vault, and we've partnered with both of them to really assist us with the distribution of the vaccine. Kind of at a point right now where we're not using them to their full capacity. It goes back to that supply issue that the governor mentioned. Curative has a kind of a hub set up at the Terry campus at Deltech Dover. They're running events about 4 to 5 days a week right now, doing about 500 people a day, all 65 and older. Primarily, they are helping out with some of the 1A second doses on 1 or 2 days a week, depending on the allocation. Vault has been set up at Deltech in Wilmington. They did a few hundred people last week. They had 500 people last Tuesday. We had to cancel this week because of the weather. A lot of their staff comes in from out of Delaware, or was coming in from out of Delaware this week to finalize some training with their Delaware staff they're brought on board. They'll be back up and running next week, Tuesday and Wednesday again. And these are all by invite only and pre-registration events that we're using the wait list for. So if there's somebody 65 and older, they've registered from the state. As the team at the Division of Public Health goes through and looks at location, zip code, age, underlying conditions, that's how they get invited to these events. But sign up online, they're in and out. Very similar setup, similar to what the state did at the Chase Center on Saturday. You walk in, you check in, you go to a vaccination table, then you get observed for the 15 minutes. We've had some great feedback. We are looking to expand Curative, hopefully the week of the 15th. Supply dependent, vaccine dependent, with a location down in Georgetown, as well as a second one up in the Newcastle County area that we're still finalizing. So exciting to help bring this. And again, it's casting a net over the community, knowing that it's not one partner or one size fits all to get the vaccine out there as needed. So that's all I have today, sir. Back to you.
Yeah, thank you, AJ, for that report. Thank you for everything that you and your team are doing, and our partners on testing, includes Newcastle County again. So shout out to them for all their help with testing. With those numbers, again, shows me that people are dialed in. I'm really happy with where we are. We went through this sprint to get a vaccine that was sitting in refrigerators and on shelves into people's arms. We're doing as well as anybody in the country with respect to that. We are poised perfectly to deliver as many, to vaccinate, to administer, if you will, as many vaccines as the federal government can provide to us as they ramp that up. They've made a commitment today to ramp it up by over 20% what comes to us. They've committed to a small amount to add in addition to pharmacies across the country. We expect and hope to be able to provide more supply to the pharmacies, primary care, and use those networks as well. We've got great partners now with Curative and Vault. All we need is supply. We get supply, we'll get vaccines into people's arms. We get vaccines into people's arms, we'll get healthier, we'll get safer. We'll be able to get back to where we can have more fit people circulating, more business activity. I know that's really important for so many small business folks in our state. We have provided tens of millions, hundreds of millions of dollars of support for our hospitality industries and other small businesses beyond what other states have been doing. And like I said, we're poised to accelerate into getting better in the spring, getting people vaccinated, making sure we're testing. Can't lose track of where we are though, because we do have these other variants that folks have been talking about. We got to be cautious about that, but we can look at and see a brightening light at the end of the tunnel. It's going to get brighter and brighter with every day and every week, with every vaccine that we get into somebody's arm, and we're going to get better and stronger throughout. So with that, I know we have lots of media on the line, and we're certainly open to any questions that you have. Thank you for joining us again. Look forward to your questions.
All right, first we'll go to Amy Cherry with WDL.
Hi, everyone. Thanks so much. First question, the focus recently has been so much on vaccinations, but I wanted to touch on a slightly different topic. The FDA has sent out a warning that curative tests are providing a high rate of false negatives, particularly in people without symptoms. Some states and cities have announced that they're ditching the tests. I'm wondering if Delaware is concerned by this warning and whether it's making any changes to its testing program.
AJ, you have any report on that?
I know we had several meetings about that when that bulletin came out, but I'm gonna turn over to Dr. Tay to cover the medical aspect of it.
Yeah, our team has done quite a bit of validation of the curative test, and we are very pleased with the performance. The study that the federal government looked at really didn't take into the account that the PCR test often remains positive past the time that somebody is usually considered contagious. So what the curative test really is doing a great job of is identifying when individuals, not only are they positive, but are they contagious as well. And so again, we're very pleased with the curative test. The validation studies that we have done confirm that. And there's also some other validation studies that are in the pipeline to be published. So it's been a successful program for us. Delawareans like the convenience and the non-invasiveness of the curative test. And so we plan to continue making it available.
The only thing I'd add to that, Amy, is you know, we did a lot of due diligence when we brought them back on board in May to event. And just a little story to tell you, like Dr. Pescator was going to people's houses and calling them up and doing control samples. If we knew they were positive one day, he went back a week later, did both something we ran in the lab and something we'd send in curative. So, you know, we consistently, you know, public health consistently looks at the modalities and making sure everything is done correctly. Curative has done a lot of retraining with our staff that has performed these tests, including the National Guard, the nurses and staff at long-term care facilities that are doing it themselves, as well as some of the schools have them. So it's nothing we take lightly or sweep under the rug. We were on this within minutes of seeing the announcement and still feel confident, as Dr. Tay says.
Second question that I have, the number of women who've gotten the vaccine so far is close to double the number of men, according to the tracker. Wanted to get your insight on that. Do you attribute this to more women being in the demographics that are currently eligible to be vaccinated, or is there more vaccine hesitancy among men?
Yeah, so we've had a lot of discussion about that, and there's some thoughts that people have that I won't share, but I think some of it goes back to the distribution in that 1A population, healthcare workers, frontline healthcare workers, and that type of thing. You would think it would swing the other way with respect to first responders, et cetera. And I would think that in the elderly population, you know, the life expectancy for women is higher than men. So we haven't done a study. Dr. Tay, we've had some just superficial conversations about that, and observations that, as Amy says, that women are twice as likely to get vaccinated as men at this point.
Yeah, I mean, you said it as we believe it to be true. There are more women who are healthcare workers than men, and additionally, women tend to live longer, and so with our wait list, we have done more to select older individuals, and so we believe that those are the factors at this point.
All right, next we'll go to Tim Mastro from Delaware State News.
Hello, everyone. Good afternoon.
Hi, Tim.
First question, a quick question on the supply that's currently in the state. There's basically double the amount of Moderna than the Pfizer vaccine. Is that by design? Does the state have a preference on which type of vaccine it prefers?
Dr. Rattay or AJ?
Yeah, so no, we don't have a preference, Pfizer over Moderna. We just take whatever the federal government will send to us. And most recently, they have been sending us more Moderna in comparison to Pfizer.
It is easier, though, to handle out with our partners, is it not, AJ and Dr. Rattay, because of the freezer requirements?
Yes, that is correct. The Moderna does not have to be at those super ultra cold temperatures. It also has a longer shelf life in the refrigerator of 30 days as opposed to 5. So the Moderna is easier to manage.
All right, and then another question on, I know the time in between doses, there's been word that you can wait up to 42 days. I'm just curious, what happens if, God forbid, you have to go later than 42 days because of a lack of supply? Would the cycle have to start over, and then a person would have to receive 2 shots again for then a total of 3 shots?
So the manufacturers don't put any cap on it right now. All these things are being looked at. What's the best duration? But there's certainly no recommendation that if you go over 42 days, you need to start over. The CDC did come out with guidance last week to say, up to 42 days is fine. But our goal is really to get as close to like that 28-day mark as possible. And so that's the way that we're going to continue to move forward. That being said, it's been a tough balance just to strike given the scarcity of the vaccine and the desire to get first doses into seniors. But we are committed to making sure that everybody gets a second dose and they get it, as close to that 28-day time period as possible.
All right, next we will go to Nick Ciolino from Delaware Public Media. Nick, you should be able to unmute.
My mistake. Hi, everyone, and thank you. Governor, your executive order from a couple weeks ago deploying the Delaware National Guard cited the violence at the Capitol as well as concerns around planned protests in Wilmington and Dover. Fencing was also set up around Legislative Hall. Do you still feel this was an appropriate response given that no violence or large-scale protests ever materialized?
Yeah, absolutely. Prepare for the worst and pray for the best. We got the best, and I was thankful.
Nick, do you have any other questions or should I move on?
That's it for me.
Okay, thanks. All right, next we'll go to Sarah Gamard from the News Journal.
Governor, one of the promises in your State of the State speech was to make permanent vote by mail. I'm wondering if you foresee any other changes that are going to have to happen for elections in the future based on what happened during 2020?
Yeah, I think vote by mail is one. Obviously, I did mention that. I always start with the proposition that we ought to make it as easy as possible for people to exercise their right to vote, not harder, not obviously, securely. And so whether there are other things, I know we had conversations. I was on call with the mayors this morning. They got a lot more participation with the vote by mail systems that we put under the emergency order for them. We expect to extend that to they have some elections this spring to do that. We can't do that permanently for them, but they got a lot more participation, and which is a good thing. And people were able to do it safely from COVID-19. So I don't know if there's anything else. Nothing comes immediately to mind at the top of my head. But again, the principle is to make it easier to vote for people to exercise their right to vote, not harder.
Have you heard any concerns or reports of people jumping the line in terms of the vaccine and how the state is trying to prevent that at all?
Yeah, I think I know what you mean by that. And I've heard anecdotal things about somebody who snuck in, got a vaccine, and maybe didn't meet the criteria. We did. I think that's why that's one of the reasons we moved to the registration appointment system. Prior to that, we had an event at Salesianum School, which worked very well for a couple hours. When the word got out that it was happening, it wasn't a pre-registered kind of event, and we just couldn't absorb all the folks who came. Showed us the demand for scarce public good like that, but also showed us that we had to somehow control appointments. That makes it more challenging, by the way, to get into more vulnerable communities with fewer resources and maybe less education and sophistication, not knowing kind of how to pre-register or get on or pay attention to where the various opportunities are. And so one challenge created another challenge, or one experience created another challenge. We knew this was always in the back of our mind, which is why the federal, the guidance was people 75 and older. We moved that down to 65 because of disproportionate number of people of color who don't live longer. And so there was that in play there. We've always been conscious of it. And that's what some of these efforts that we're talking about today are geared towards, to make sure everybody has an equitable opportunity to get vaccinated. Some people don't want to get vaccinated, and we're not forcing people to get vaccinated. But we want people to have the information, good information, that it's really important to do, and good and not harmful, and have opportunities to do so.
All right, Governor, this is the last question for today. This was pre-submitted by Chris Barish from WHYY. And AJ touched on this a little bit. It's how has the snow affected vaccine rollout and deliveries since Sunday, as well as the testing events? Were any events canceled or otherwise modified because of the weather, or did people not show up, which would be likely due to the weather?
Well, both weather, snow, vaccine, and testing are in AJ's bailiwick, so I'm going to hand it over to him.
So no, like I said before, the testing is probably going to be where we see the biggest drop this week, because we just took yesterday and then some events from today off the calendar, which will be a decrease, especially with the great work some of our partners in Newcastle County are doing. For example, yesterday was the Frawley Stadium event that brings in a few thousand people over the course of a few hours to be tested. For vaccine, we did postpone the Vault event up in Wilmington. That was supposed to be this week. However, Dr. Hahn's going to work his magic, and that vaccine's not going to be sitting there waiting for next week. There's ample demand for it across the state, so it'll just be put to good use with other partners. But I think we still got another, probably 6 weeks where this is going to be, something we have to keep an eye on. We also saw the same thing in the summer when we had thunderstorms come in and close down events early as well. So we'll manage through it. The good news is, as the governor said, we have a distribution network right now that could get rid of vaccine faster than we could get it in the state.
And that's really the point to end on. We've come a long way, kind of in a month and a half with respect to vaccination. A lot of learning, got a lot of vaccines out, over 100,000 doses, got a tremendous team working really hard. We had some missteps. That's my responsibility. I was pushing hard, wanted to get those vaccines out. I'll take responsibility for folks that had to wait too long in line, but we're getting better at it. And we have a network, as AJ just said, that's ready to deliver vaccinations once we get the vaccines and the supply from the federal government. That's ramping up over the next 3 weeks. What I heard from the White House this morning, 22% plus some increment above that for pharmacies. That's all good. It's not nearly enough. It's not nearly what our network of providers and partners can deliver. We can deliver much bigger numbers than that. It's just to be a function of supply. We still have to pay attention to protective measures, mitigation, wearing the mask, social distancing, sign up for our COVID alert, COVID-19 alert, have that app on your phone just in case that vaccine gets to you. Be cognizant of the fact that we have these so-called variants that are now circulating here in our country. They're going to come to the state of Delaware inevitably. That means you just got to be cautious and protective. Make sure those of you who are 65 and over, you're still in that 1A group and you haven't been vaccinated, take advantage of the opportunities that we have. If you want to volunteer and help, one of the things that you could be really helpful with is helping our seniors, particularly those who without access to computers and technology, get registered and get into our system, make it much easier for us to get an appointment for them with a vaccine. Check your pharmacies and your primary care. We're pushing more supply to them next week and in the weeks to come. We need an equitable distribution, and we'll keep working on those channels, working with our community organizations, with our pharmacies and with our hospitals. So thank you very much for joining us this time. We look forward to seeing you next week.